Hi, I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. And I teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Now, today we're going to talk about something that is driving most of the pressure in healthcare right now: chronic disease. Because when you really look at what's overwhelming healthcare systems, it's not acute care, it's not one time conditions, it's patients living with chronic diseases that require ongoing management. And the way we're currently managing them is not working. Let's walk through what this actually looks like. You have a patient with diabetes, hypertension, and maybe early heart disease. They come into the office, medications are adjusted, labs are reviewed, they're told to monitor their blood sugar, they're told to watch their diet, and then they leave. Now, what happens over the next 3 months? They're at home trying to manage all of this on their own. They may not fully understand their medications, they may miss doses, they may not know what their blood sugar readings really mean. They're trying to make changes to their diet without clear guidance, and no one is checking in. No one is reinforcing the plan. No one is helping them adjust when things don't go as expected. So over time, their condition becomes uncontrolled. Blood sugars rise, blood pressure increases, symptoms start to worsen, and then they show up again worse than before, or they end up in the emergency room. Now let's step back for a second, because this is where we have to look at the system. We are trying to manage long term, complex conditions with a model that was designed for short term acute care. That's the disconnect. Let's look at what we're actually dealing with: patients with diabetes, hypertension, heart disease, obesity, and often multiple conditions at the same time. These are long term conditions. They don't get resolved in a single visit. They require ongoing monitoring, medication adjustments, lifestyle changes, continuous education, and support. But our system is still built around short episodic appointments. So we're trying to manage long term conditions with a short term model. And that's why it feels like the system is under pressure. Now, think about how often patients are actually seen. Maybe every 3 months, maybe every 6 months. So, what happens in between? Patients are left to manage everything on their own: taking medications, adjusting their diet, monitoring symptoms, trying to follow a plan they may not fully understand. And when there's no support, things start to slip. Blood sugars go uncontrolled, blood pressure rises, symptoms worsen, and eventually they end up back in the office or in the hospital, and we repeat the cycle. This is reactive care, not proactive care. It's not just about prescribing medications. It's about behavior. It's about consistency. It's about identifying barriers and helping patients work through them. And that takes time. It takes follow up. It takes someone who is consistently engaged with the patient. And that's what's missing. This is where care management changes everything. Instead of relying only on appointments, care management provides ongoing support between visits. Without care management, patients leave the visit and they're on their own. Problems go unnoticed. Conditions worsen over time. With care management, patients receive regular check ins. Medications are reviewed and adjusted as needed. Education is reinforced in a way they understand. Symptoms and trends are monitored over time. Barriers are identified and addressed early. And because of that, conditions are better controlled. Complications are reduced, hospitalizations decrease, patients feel more supported and more in control of their health. This is not about adding more visits, it's about adding continuity. It's about making sure the care plan is actually being followed over time. So, when we talk about chronic disease overwhelming healthcare, the issue is not just the number of patients, it's the lack of a system to manage them consistently. And that's exactly what chronic care management was designed to do. Moving forward, healthcare is shifting toward value based care, which means outcomes matter more than volume. And you cannot improve outcomes for chronic disease without consistent ongoing support. That's where nurses come in. That's where care management becomes essential. If you're a nurse and you want to learn how to step into care management or build a business around supporting patients with chronic conditions, I break this down inside my online school, Empower Care Academy. I'll leave the link below so you can join us. And if you're a provider looking to better manage your chronic patient population while improving outcomes and reducing costs, care management is one of the most effective solutions available. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.